Thanks, Erica. Inside this vial are black-legged ticks, otherwise known as deer ticks. Don't worry, they're dead. I went out to Fender Nature Center in Lansing with Professor Jean Tsao as she collected samples of these ticks, which are known to transmit Lyme disease. She says Michigan is seeing an uptick in all kinds of ticks, including these ones right here.
So we just dragged about 20 meters across the vegetation on the side of the path, and that's a standard distance that our lab does.
Jean Tsao has been studying ticks since 1994.
And so when I flipped it over, and this does not disappoint, there's one here, there's one here.
If you can't see them, it's because they are the size of poppy seeds.
And then I'll go ahead and just put it in.
Tsao moved to Michigan in the early 2000s.
In the early 2000s, they started coming in the southwest Michigan area and then moving north along Lake Michigan. And that's when I had come, and the graduate student I worked with had documented that. And then coming in towards Lansing as well. But coming inland towards Lansing has taken a long time compared to going up the lakeshore.
Ticks are growing across the state and across all species. The one you will want to especially look out for are...
And these are all Ixodes scapularis, which is the black-legged tick, which is also known as the deer tick, and it's the tick that transmits the Lyme disease pathogen.
The Michigan Department of Health and Human Services said in 2021 there were 878 confirmed and probable reported cases of Lyme disease, double the cases reported in 2020.
And then all of a sudden, in the past 5 years, tick numbers have gone up. Ann Arbor, Washtenaw, Ann Arbor, like that area, the ticks have just started really increasing in the last, I think, 5 years.
Tsao said that when she used to go out to Fenner Nature Park in 2004, there weren't any ticks to be found.
But then a member of the public submitted a tick to the health department, and they were told that they got it off their dog.
That was in 2014. Tsao studies ticks to understand what the relative risk is by determining what species of ticks are present and in what abundance, what pathogens each species carries, and then the number of ticks found that actually carry said pathogens, because not all ticks are infected.
If you're playing in the grassy areas, know that you're more likely to come across a dog tick. If you're in the woods, you're more likely to come across a black-legged tick or a lone star tick if you're in southwestern Michigan.
Most of the time, people do not see if a tick has bitten them unless it is still attached.
If you find them attached to you, what you should do is find where it's attached to you at the closest point to your skin, take the tweezers, and then pull it off directly. Don't grab it at the large end that may be engorged because you might break the tick in half.
Clean the spot, and if you can, be sure to save the tick in a baggie with the date and location and show your physician. Tsao said that in order for a black-legged tick to transmit Lyme disease, it will have to have fed for at least 36 hours. To find resources on how to prevent ticks, what to do if you think you've been bitten by a tick, where the highest risk places for ticks are, and more, go to fox47news.com.